Hi guys, it's Dr. Mara Weinstein, and I'm going to be giving a fall beauty webinar talking about all the things about cosmetic treatments and skincare through the decade. So I hope you enjoy. There's a lot of information, and make sure you drop any comments below as we get started. Hi everyone, good afternoon. I'm so happy to be here with you, and thank you so much for spending your lunch hour with us. We are excited to share a lot of great information all about what we do here in the office and sort of the latest and greatest now in skincare and how to keep you looking like the best version of yourself. So today we're going to take the approach of walking through the decades, which is super exciting because it's a common question that I get in the office and don't get to address as thoroughly as I would like to. And so first we're going to go over some examples of the types of patients, concerns that I see on a day-to-day basis, and then we'll walk through skincare in your 20s and your 30s, 40s, 50s, 60s, and beyond. So I'd just like to give a brief intro about my background and my history. What am I doing here in Rochester, serving this wonderful community? So I am a board-certified dermatologist. I did a fellowship year of training in Boston at a practice associated with Harvard and Yale schools of medicine. And during that year, I learned all about the science of lasers and laser technology. In fact, I participated in a number of clinical trials that led to the launch of a lot of the lasers and technology that we're using today. And I also learned all about injectables and the science related to those. So neuromodulators like Botox, Dysport, and also fillers, hyaluronic acid-based fillers, and also biostimulatory fillers. So I dedicated a portion of my training to dive deeper into that realm of medicine, and I'm happy to share that with the community here in Rochester. I'm also the Director of Cosmetic and Laser Dermatology at the University of Rochester Medical Center, where I work with residents and teach them all of my knowledge and really try to train them so that when they go out into the workforce, they're ready, they feel confident about being able to offer these procedures. And so at the University of Rochester, I am an Associate Professor of Dermatology, and I also serve as the Diversity and Inclusion Officer. So aesthetic dermatology is an interesting field, and I say that because there are so many ways to access some of the things that we do in this practice in more of a medical setting, but there are lots of options when it comes to aesthetics, and it can be a very confusing and overwhelming feat. In my office, I see a range of patients from, teenage years, we treat acne and acne scarring, all the way to 80s and even 90s in some cases, and it is my absolute pleasure to treat these ranges of ages and to be able to offer the services I do that are tailored to each decade, if you will. So an example of a 20-year-old patient, I see a lot of patients who come in their 20s. They are right in the thick of social media and influencing. They have a lot of questions about skincare and prevention of some of the common early signs of aging. And so my goal in that population is to guide them and to help them start with little tweaks in their skincare to prevent. Now, in the 30s and 40s, I might encounter patients who have just had children, tired mothers who have dedicated maybe the past 6 years of their lives to being pregnant and producing children. And in that population, they really want something to help them feel refreshed again. They don't want to look so tired all the time. And you look as good as you feel. And so when patients look good, they're able to walk into a room confidently, re-enter the workforce. And that's really my goal in that decade. And then in the latter decades, I see a lot of patients who spent the last 10 years taking care of their sickly spouse, or maybe a grandparent, or maybe their own parents. And these patients really want to get back on track with self-care, taking care of themselves. So this is not something where you should be looking at it as being vain or ashamed to come in and ask these questions. Now, the American Society of Dermatology is one of the most well-respected societies, comprised of dermatologists who have similar training as I do, both in surgical dermatology and aesthetics. And every year they do a survey, and in this case, last year in 2023, they surveyed over 3,000 consumers. And this is just to show you that you are not alone in these concerns. So, these patients who are seeking cosmetic care, dermatologists were the #1 most influential doctors, and these were the ones who patients were seeking out. So really, to start with a board-certified dermatologist, you can't go wrong. The top factors in provider selection were price, specialty, before and after photos, referrals, level of licensure, and dermatologists were the physicians of choice for these things listed. Some of the most common things we do: injectable wrinkle relaxers, injectable fillers, platelet-rich plasma for both skin rejuvenation and hair loss. And you can read the rest for yourself, but dermatologists are the leading provider of these cosmetic aesthetic. And so, where are we getting all of this information? Digital influence is huge. I don't have to tell you that. You're here on the webinar and somehow you heard of it, whether it be a Facebook ad or an Instagram ad. But 84% of consumers say that the decisions they make in pursuing aesthetic care is based on what they see online. And so let's get started. The key question is, why does aging happen? Why do we see the changes on our skin that we do? And there are really two major categories. So there are internal factors, which are things that we can control, like the total sun exposure, pollution, stress, illness. These all contribute to aging changes. And then those are the external factors. And then there are internal factors like physiology, genetics, skin type. On the slides, those should be reversed, so not to confuse you, but external things are things that you are exposed to, right? So the sun, pollution, stress, all the things I mentioned. And internal are things you don't really have control over, like what you've inherited, your physiology, your skin color, your genetic. And these are all factored in when we think about why the changes happen on our skin as we age. So when we think about aging, we can describe a youthful face as having the triangle of youth. So we see high cheekbones, a very defined jawline, a lifted mid-face, and really the focus is on the eyes. And then as we get older, this is a mother and daughter. The daughter's age 26, the mother is age 64. As we get older, we describe that aging face as looking like an inverted triangle. And so there's a lot of heaviness around the jawline, a little bit of jowling. The focus is less so around the eyes, but more in the lower face. And often we have patients come in and complain that they feel like they're looking sad all the time, that their face looks heavy. And this is something that we really would like to help with. And the key here is to prevent this before it starts getting to a place where surgical intervention might be necessary. So as we get older, we lose volume in our bone, and that's because it starts resorbing or shrinking. And around the eyes, the bony support that sort of supports our orbit will start to widen, and that's why our eyes look a little bit more hollow, and that's why we get what we call tear troughs or volume loss around the eyes. The other thing that happens is our mid-face starts to kind of shrink in, and so that's why we see a lot of volume loss right at the corners of our nose, and we start to develop these nasolabial folds because of the resorption of that maxilla, we call it. So the maxilla and the mandible, right? And so the lower part of our jaw, which is the mandible, also starts to resorb, and we lose that bony structure in which our skin sort of drapes across. And so it starts to show these signs of jowling, and that's all really partially due to changes in the bone. The other thing that can happen is our fat pads. In the lower photo you'll see we have multiple layers of fat pads, and our fat pads will shrink and shift. Now, especially if you've gone through a lot of weight loss, so a lot of my patients now are on these GLP-1 inhibitors, so they're going through extreme weight loss, and you'll 100% see that in your face, and that's partially due to your fat pads shrinking. And so all these things together, you see these signs of aging that we will strategically address. So now let's jump right into the decade. So skincare throughout your life and how it changes through each decade. So starting with the 20s. So the number one thing a 20-year-old, even younger, needs to know is they need to be wearing sunscreen. Why? Because sunscreen will help prevent the effects of UV irradiation on the skin, which leads to collagen degradation and the development of brown spots and potentially the development of precancerous lesions even as early as your 20s. The other thing we start to see in our 20s is hormonal changes, hormonal type acne, and acne kind of left over from teenage years. So I have a lot of 20-year-old patients who come in worried about blemishes on their skin or the leftovers of acne. I don't want to say scarring per se, because a lot of times this can be reversed, but there's evidence of acne on the skin. So things that we can do to help prevent and treat these changes on the skin that we see are chemical peels, preventative Botox. I'll show you a little bit more in depth about these procedures. And we can also recommend products in addition to sunscreens like lightweight moisturizers and retinol. So on the left, you're going to see an example of me doing a chemical peel. Now, this is a patient in her 20s who was concerned about pore size, a little bit of texture change. She had a little bit of acne. And so we can use things like salicylic acid peels and glycolic glycolic acid pills, which not only help to hydrate the skin, but they help to gently chemically exfoliate the skin without you having to scrub. There's really minimal to no downtime, and they can be performed monthly. So now in the 30s, so we are starting to see in the 30s early signs of aging. So some of my 30-year-old patients will start to develop etched lines across the forehead, or those frown lines in the glabellar area, which is here where most people know as the 11s. And you'll start to notice that you frown or you squint and those lines stay in the skin. And so this is the time to really think about things that will help to stimulate cell turnover so that the skin is always producing collagen. So common treatments that we can provide during this decade are things like microneedling, low energy lasers like the Clear and Brilliant, IPL or BBL, which stands for broadband light treatments. And all of these treatments can help with gentle skin rejuvenation, resurfacing, and also lifting brown spots and sort of the early signs of aging off the skin. Something we see a lot of in this decade is melasma. This is a decade where patients are getting pregnant, starting to think about having children, and they're going through a lot of hormonal shifts. And melasma is a condition that can occur during pregnancy and then persist for many, many years. There's also hormonal and postpartum changes, fine lines on the forehead, as I mentioned. So this is when we start to talk about retinoids, really prescription-based retinoids to help stimulate cell turnover, and serums like vitamin C serums that deliver antioxidants to the skin to help prevent those early signs of aging. We also offer a procedure called pulse sculpting. The scientific name is cryolipolysis. So we use a device to selectively freeze fat cells where we can treat stubborn areas of fat. Okay, so now we're moving into that kind of mid-decade, the 40s, where we see a lot of crises, right? So these patients may have just had a bunch of children, are now, like I mentioned earlier, looking to get back on track with skincare or really seeing those signs of aging in terms of volume loss. And so this is when we really try to think about biostimulation with fillers, starting neuromodulators like Botox, Dysport, Xeomin if they haven't started them already. And so in your 40s, we're also starting to see hormonal changes like loss of estrogen. So when we lose estrogen, we lose that lipid barrier, that cushion, that hyaluronic acid. We lose collagen, so our skin becomes more dry, our pores become more enlarged. And so we really have to address those changes with thinking about hormonal replacement therapy, which I personally don't prescribe, but we have colleagues who do at the university, and also addressing those changes with lasers, things that are implementing more permanent type changes in the skin. We can also think about skin tightening at this age. I feel like this is a decade where patients are at that crossroad of, should I get a facelift or should I stick with minimally invasive? And again, if you start early, the goal in my practice is to help prevent you from going under the knife. Halo stimulates collagen and elastin. You get this radiant, smooth, healthy looking skin. We can use it for acne scarring, fine lines, wrinkles, and texture changes. And like I mentioned, it helps to minimize that pore size and also with discoloration. Something else we can do in the fourth decade is injectables and fillers. So here you see a patient who is noticing some volume loss in her temples. This is a common area where we lose volume as we age, but it's also a common area that's missed in the consultation. And it's not something I see patients come in and say, oh, I'm here because I want my temples filled. That's something that we, look at together in the mirror and notice that as we get older, our face starts to look a little more skeletal and hollow in the upper face. And so this is an area that we can address with injectables. Now in your 50s, so remember, it's cumulative. So it's all of those things that we mentioned, but now we're just adding little by little other things that can help. Now in your 50s, the goal, all of the things above, and then also restoring elasticity and managing that dryness that we mentioned happens with the hormonal changes and the loss of estrogen. And this is also an age where if you had a lot of sun exposure in the past, so you have a history of indoor tanning or blistering sunburns as a child, or you just didn't practice healthy skincare habits until maybe your 40s or 50s, we start to see these little precancerous lesions starting to pop up. And we call these actinic keratoses. And so these are like rough pink spots on the skin that maybe in the shower, they'll kind of slough off with washing, and then the next few days you see them pop right back up. And this can be really frustrating for patients, but it's also a telltale sign that you need to seek help from a dermatologist. Other things we can do in this decade are tightening procedures. We can start as early as our 4th decade, but really hone in on this in your 50s and recommend richer moisturizers, serums, and even facial oils. Now, we talked about skin tightening, so this is our procedure for skin tightening on the left called Soft Wave. It's an ultrasound-based skin tightening device. We usually treat the entire face and neck. We can also treat other areas that are prone to laxity, like the abdomen, postpartum abdomen, or right above the knees. This device, the beautiful thing about it is that there's zero downtime, and so you can have a treatment with the Soft Wave and go straight back to work. And so in your 60s, it's really about maintaining. Okay, so we are going to continue using these minimally invasive devices. And I should really say 60s and beyond, because it doesn't stop at 60s. Now, in this decade, we also think about maintaining with biostimulatory fillers. Those are fillers that help to stimulate collagen over time. And so we typically require 3 sessions. So this would be Sculptra or Radiesse. So now in sum, what we just described were the 5 pillars of anti-aging treatments. What we aim to do is repair the skin from the changes due to sun damage over time. We aim to relax the muscle action. Our next R is restore. We resurface the skin texture. And then I kind of did this backwards, but if you look on the left, you'll see there the 5 R's of anti-aging and then a number of skincare products that I recommend. So if you take a screenshot of this picture, you can do a hard press on your phone and the link to that QR code will pop up. And it's a website called Howl that will direct you to all of my skincare recommendations. This past June, I decided to start a YouTube channel where I go over different conditions and different questions or maybe debunk some myths that I've heard online. And so I really encourage you to take a look at my YouTube page. The link will be on the next page. And don't forget to subscribe so you'll be notified when new videos and new information come out. So now I'm happy to take your questions. Thank you for your attention. Thank you for hanging on with us for this long. You can enter your Q&A questions in the box below and we will go ahead and start answering that. We're talking about cost of some of these procedures. I would say in terms of budget, so your neuromodulators like Botox and Xeomin and Dysport range from about $400 to $700, $800, and that's per treatment. It's variable based on how many areas you're getting treated and how often you come in. So I'd say the majority of my patients come in 3 times a year and they're spending on average about $550. In terms of lasers, so as you saw, there's a whole range of different lasers we offer. Something like a halo is going to cost about $1,500 to $1,800 in our office. And, we do recommend 2 treatments. We are able to offer discounts if you buy them sort of together. Our skin tightening devices are the most expensive, but they also require the least amount of office visits. That's something that is going to be sort of in, thousands range.
Okay, we have a question about preventive Botox and what age you recommend starting and what your thoughts are about that.
Yes, I started at age 26 and have been doing little bits over the years to prevent the development of etched lines on the skin.
We have a question. Do you approach African American skin with the same approach when using sunscreen? And how important is it to use sunscreen if you have that type of skin? Should it be used in the winter as well?
Absolutely. So African American skin should be treated the same way when it comes to sunscreen as any other skin type. And I'll tell you why. Even though you are less likely, African American skin patients or darker skin patients are less likely to develop your normal type skin cancers that we see more in Caucasian patients like basal cell and squamous cell, which typically occur on areas that are exposed to the sun. But that doesn't mean that they're not subject to the effects of UV irradiation just like everybody else. So UV irradiation causes degradation of collagen. It can cause discoloration, dyspigmentation on the skin. It can also break down elastin and lead to that sort of sagging look of the face because that's all due to elasticity and collagen. And I'll tell you, in my darker skin patients, the number one complaint or concern that I hear is discoloration. So their skin is uneven, the skin tone is uneven. And so wearing sunscreen will help to prevent your skin from becoming uneven and to maintain a natural natural overall sort of even tone and also prevent the development of accelerated aging changes on the skin. Famous singer Bob Marley died from melanoma, which is a skin cancer, and it was on his toe under the nail. He thought it was a bruise because he was an avid soccer player, and it happened to be skin cancer. So I always tell that story because I think it's important for everybody across all races and skin tones to check their skin regularly.
I have a question about rosacea and if lasers can be used with rosacea.
Yes, absolutely. And I didn't mention that per se because we see that across all decades, but rosacea or facial flushing or redness on the skin can be treated with lasers. In fact, the pulse dye laser, which is one of the lasers we have, it's called the V-beam, the brand name, that is sort of the gold standard for treating rosacea when it's purely due to dilated blood vessels on the skin.
Question, what specific products do you recommend for discoloration from tinea versicolor on the lower back and redness from keratosis pilaris on the arms?
Those are great questions. I'm not able to give sort of medical advice without assessing the skin, and so I'm happy to see you in the clinic and suggest products for that. What I can say is that tinea versicolor is due to yeast on the skin, so a lot of the products we recommend are to target yeast, so the anti-yeast products over the counter like a selenium sulfide or a Head and Shoulders type of thing as a body wash.
We have a couple questions about at-home devices. Do red light and radio frequency devices work, or are there any at-home handheld lasers you could use?
Yes, absolutely. So I love this whole trend of at-home devices. They're pricey, and so I get it. It's worthwhile knowing how good of a job it's going to do for you in your own home. I think the rule of thumb is really know thyself, right? So know whether or not you're going to take the time every day or whatever the prescribed treatment regimen might be. But typically it's a time commitment at least 3 times a week, so 30 minutes 3 times a week or every day to apply the device, whether it be a microcurrent or a red light mask.
We have time for one more question. Someone was asking if you offer facial balancing. If you could describe that.
Yes, I do. We do facial balancing with our injectables, and so that's really where I like you to bring in pictures of what you looked like when you were younger, and we try to identify the specific changes that are going on in your skin and your face and rebalance or put things back to where they used to be. As an example, another thing we do, and I showed you the picture of the patient where we filled her lips, we're able to evaluate your face and see what areas can be enhanced so we achieve a more balanced look. Now, some things we learn in training are, complex measurements and proportions of how a face should look, and all of that is important, but at the end of the day, everybody's face is different and unique, and I think it's really during that special time, one-on-one in the clinic, where we talk about what things we can do to make subtle differences to achieve that facial balance without looking fake or weird or different or enhanced. And I'll just put a plug in, a lot of these questions you asked, which were amazing, thank you, are addressed even more in depth on my YouTube page. So we just launched a new newsletter called The Expert Aesthetic, and we hope that you will all sign up to receive it. And we're gonna go over all the latest trends, debunk all the myths, and link to some of the videos that we've filmed over the course of the last few months and give you access to that. So we're so happy for you to become a part of our community. And with that, I guess we'll close the webinar. Thank you all for joining. Thank you for your questions. And I hope you are able to drop your info in the comment box so that we are able to grab that and help you schedule appointments or answer any more of your questions. Thank you so much.